Okay, this video is called Healthcare's Conflict of Interest, and this is a big conflict of interest. This is fundamental to the problem with why healthcare cannot cure patients. And what it comes down to is they have a dilemma. If you cure the patient, you lose the customer. The way you make money is you want to get the patient hooked on drugs. If the patient's hooked on drugs, takes a pill every day, you milk them like a cow. Every day you take money, you pick money out of their pocket. So there's no incentive to cure the patient. The patient goes to the doctor because they want to have a cure. But it's in the healthcare system to not cure the patient. So that's a problem if you want optimal outcomes. And that's why a patient as an individual should seek optimal outcomes. They have to study their disease. To some extent, you're on your own and you better learn about your disease. Now, don't get me wrong, doctors have a lot of valuable knowledge that you can benefit from. And the doctors do want to help the patient, but there are a lot of things that make it difficult for them to do so. So first of all, you have to realize when a disease is called chronic, that's a euphemism. That means that conventional medicine is saying they cannot cure it. And they will tell you that they cannot cure obesity, hypertension, diabetes, leaky gut, abdominal pressure syndrome. They'll say obesity can be cured with gastric surgery, which is a major, giant, thing. And we'll come back to that in a future lecture. Okay, but anyways, the significance of obesity, hypertension, and diabetes, as well as leaky gut, abdominal pressure syndrome, these are fundamental major mechanisms of causing disease. I would call these the gateway diseases. These are like the marijuana of health, okay? These are the problems that lead to most other problems. And you get all of these from eating a high-fat diet with processed foods, okay? And with excessive sodium contributes to this as well. Okay, and all the chemicals in processed food. So these things generate billions and billions of dollars for conventional healthcare. And they cause at least about 75% of disease or more. And here's how it works. These are the main risk factors for hypertension and atherosclerosis. So you get hypertension, you get atherosclerosis, you plug up the arteries in the heart, you get myocardial infarction in the short run, congestive heart failure in the long run, AFib in the long run, okay, all these problems. You plug up the arteries of the kidneys, you get kidney failure. And then there's abdominal pressure syndrome. Because you're constipated, constantly straining at defecation, your stomach starts popping into your chest, hiatal hernia, you get gastroesophageal reflux disease, and that's associated with esophageal cancer eventually in some patients. Okay, the back pressure on the sigmoid colon leads to diverticulosis, can lead to diverticulitis, very common reason for hospitalization. In the same patients are at increased risk for colon cancer, which is quite common. Okay, the same high-fat diets lead to gallstones and what's related to that, acute cholecystitis, etc., chronic cholecystitis. Okay, kidney stones can be a very big nuisance. It's a pain in the butt. You don't want somebody sticking a scope up your Johnson to snatch out a kidney stone or going through your kidney through your back. Okay, they cause small vessel atherosclerosis in the brain. It's the main thing they do, but they can, of course, cause a big stroke. It leads to dementia over time. It's a major part of what leads to dementia. And, most importantly, the same things that plug up the arteries in the heart, the brain, the kidneys, and elsewhere, they plug them up to the Johnson, you'll be impotent, okay? So anyways, the point of all this is that you cannot cure a dietary disease with a pill. So the idea of a system based on treating the common chronic diseases with a pill means that it can never work. And I've also joked that this is like Dante and Virgil standing before the gates of hell in Dante's book, The Divine Comedy, the chapter on the Inferno, where the sign above the gates of hell says, "Abandon hope, all ye who enter." So conventional medicine cannot cure the common, most important problems and the vast majority of diseases. So only a chump would treat these diseases primarily with a pill when it's so easy to, go to low-fat vegan with no oils and cure yourself. And quite often, if you catch it early enough, once the disease is chronic, there might be, tissue damage that's partly irreversible. But anyways, this is the fundamental conflict of interest, and there is no way around it.